Hello, everyone, and welcome back to our February Safety Series. We hope you've been following along this month as we covered a variety of topics every Friday. We wanted to wrap up our February Safety Series today with infant safe sleep as our topic. We think this is a very important topic, and we have Dr. Karen Schetzina with ETSU Pediatrics here to cover the topic for us, and we consider her our resident expert on safe sleep. My name is Tiffany Cook, and I'm the Trauma Injury Prevention Coordinator here at Niswonger Children's Hospital. And now I'm going to turn it over to Dr. Schetzina.
Thank you, Tiffany. I am thrilled to be here to talk about safe sleep. This is such an important topic. Unfortunately, we still every year have babies die in our region from unsafe sleep practices. We know so much now about how to prevent sudden unexplained infant deaths. Let me start by sharing some of this information. So, first of all, it's safest for infants to sleep in the same room as their parent or caregiver, but not in the same bed or sleep space. Instead, you want your infant to sleep in their own crib or bassinet in the same room with you. Secondly, during the first year of life, we recommend always placing infants on their back to sleep. This is the safest choice, even if they're a spitty baby or have reflux. And when infants get old enough developmentally to start rolling over onto their tummies, that's okay. You still want to place them on their backs when you put them down during that first year of life. And then finally, you don't want anything else in the infant's crib or bassinet with them while they're sleeping. Let me go ahead and do a demonstration of what this looks like. So we have our newborn baby here in a bassinet. You can see that she is swaddled and she's wearing a hat. She's sleeping on a firm surface covered with a fitted sheet. So I'd like to point out a couple of differences that you may see in different settings. Here in the birth center, after babies are born, they are still transitioning and stabilizing. So we often will swaddle them and place a hat on their head to help them stay warm. However, it's important for you to know that the American Academy of Pediatrics does not recommend using a hat with infants for sleep after they go home or after the first 24 hours of life. The reason for this is that overheating could be caused by keeping the hat on the baby during sleep, and this has been linked to sleep-related deaths. Secondly, I want to talk about swaddling. This is a wonderful way to keep newborns warm and help them comfort themselves and stabilize. However, as babies grow, after 2 months of age, it's not recommended to continue to swaddle your baby for sleep. After that point, they're going to become more mobile. They'll be able to roll over on their own, and swaddling is no longer recommended. Instead, and you can even use this with a newborn, we recommend sleep sacks or onesies for sleep. These are fantastic because you don't have to worry about a blanket becoming unwrapped and being loose in the crib and potentially covering the baby's mouth or nose. And because again, when babies are sleeping, we don't want anything else in the crib with them. No bumpers, pillows, positioners, loose blankets, toys, or other items. So, those are some important things to know about safe sleep and how we can all work together to prevent sudden unexplained infant deaths. Of course, I want to mention there are some other things that families can do. Not smoking around babies. Breastfeeding has been shown to reduce sudden unexplained infant deaths. When moms are breastfeeding, it's really important to have a plan for returning the baby to the crib or bassinet for sleep. And then finally, you never want to sleep together with a baby, especially on something like a couch or chair where suffocation and falls are particularly high risk. We also recommend that babies get routine primary care and immunizations to keep them safe and healthy. So I'd like to end with a call to action because as healthcare providers, we really want to partner with families to spread the word about safe sleep. So please talk about these practices in your family, with your friends, and with any caregiver like a babysitter or a child care provider who may be caring for babies while they sleep. So thank you so much, Tiffany.
Thank you, Dr. Schetzina, and thank you all for following along with our February safety series. We hope that you will continue to keep up with Niswonger Children's Hospital on social media, and don't hesitate to reach out to us if you have any questions at all. Thank you.